Hello and welcome to Living the Dream for General Practitioners, the podcast for doctors and clinic leaders who want to learn about pathways, strategies and opportunities for living and working in Australia. Join me, Gemma Goff, and my expert guests as we share stories, unlock the secrets to recruitment success, share tips for moving across the world, navigating new cultures and so much more. This show is brought to you by Health Recruitment Australia. Now sit back, relax and enjoy this episode. Hello everyone and welcome to our latest podcast recording. Today I am thrilled to be joined by Donna Harrison, who is the head practice nurse for the Australia Health Alliance. Australia Health Alliance owns and runs 2 general practice clinics in the southern suburbs of Adelaide in South Australia. Donna moved to Adelaide in 2011 from Tamworth in the UK with her husband and their 3 children, where she'd been working as primary healthcare nurse for 15 years. I've asked Donna to join me today to share with us her story, why they moved to Australia, how life compares to the UK, and importantly, how does working as a practice nurse differ in Australia to the UK? So welcome, Donna. Thanks for joining me today.
Hi, Gemma. Lovely to be here.
So, Donna, as you know, we've been working on providing education on the migration process to our listeners, giving them real-life examples of migration stories in the hope to provide valuable information to our listeners to assist them in deciding if a move to Australia is right for them. So if you could take us back to your life in the UK, what prompted you to consider a life in Australia? And was Adelaide your primary state? Was that a conscious decision?
So we had thought about immigration for quite a long time and hubby wasn't over keen on the idea. It was me driving that. So over a period of time, you know, the UK, things weren't great there, and he did start to think about maybe a move to Australia was the best option for us. The driving force around that really wasn't about myself and my husband. We both had quite good jobs. We were very settled, had a home, final salary pensions, which then made it more difficult to make the decision to move. It was more around the family. So what about opportunities for the children? Our children, when we actually emigrated, were 19, 16 and 8. So it was about the children more so than about us. What would their future look like in Australia in comparison to the UK? And could it offer a better future for them? So that was where we were coming from. And of course, you know, the pull of the Australian weather versus UK rain and winter always just held that little bit of something for us.
Absolutely. And why Adelaide, Donna? Why did you pick this state in particular?
So once we'd decided to, put in an application and make that move, it was a picture of a map of Australia. And in about 10 minutes, we picked Adelaide. So looking at that map, you know, would we go to Sydney? No, we don't live in London in the UK, big city, major city, not for us. What about up north, Darwin? Onto the crocodiles there, thank you very much. What about Queensland? It's very wet and there's crocodiles and stingers there. No, we won't bother with that one. No daylight saving. What about Melbourne? Bit wet in Melbourne. The weather's not always that great and there can be 3 seasons in one day there. So that was quickly put to one side. Canberra, inland, no sea. Perth, we really liked Perth, but Perth was too far from anywhere. If the children ever moved out of Perth, it was a long way to go and costly to see them. So that left Adelaide. Adelaide's got a Mediterranean climate. It's got some of the cheapest housing in Australia. You know, there's lots of parkland. Perfect really for what we were looking for. So literally, it was a 10-minute conversation, and we chose Adelaide.
That sounds great, Donna. So tell us about the pros and cons of moving. What were your hesitations and what were you most looking forward to?
So the pros of moving to Australia is what everybody would think. You know, we've got the better weather, more family time, going to those nice locations to the beach. You think you're always going to be on holiday. So it was about the lifestyle really for the family, and particularly in Adelaide, which has with good access to wine regions, beaches. Adelaide's only about 2.5 hours from one end to the other, but half an hour inland. So you're always very close to the beaches or the hills. So it's quite a beautiful location. The cons were really around starting over again. You're starting from scratch. So we didn't have a house, we didn't have cars or jobs lined up. Was it going to work out okay before us? What happened? We got here and we felt flat on our face. So we decided to rent our house out in the UK rather than sell it, so that we had somewhere to go back to if we decided that it wasn't for us. Whether that's a pro or a con is two different things, because then we didn't have the finances to be able to bring money over to make life easier. So we were more tied financially. But it was really also like a reset opportunity. You look back on your life and think, oh, if we could do things differently again, how would we do them differently? And this is a whole new start, a new beginning, and doing things differently if you choose to. So, yeah.
We speak to those that are looking to migrate, and we say, nobody knows you overseas. You can change your hair, you can be whoever you want to be, because no one knows you. So if that reset is exactly what it's like. It's an opportunity to start completely afresh.
One of the other things were that our daughter was ready to go to university, so we had to come when we did. Otherwise, she would have started university in the UK, and then the whole family would ever have migrated together. So she had to. We came here and she started uni in Australia, which was a challenge because we weren't eligible for HECS, which is the Australian student loan. Even though we came as permanent residents, you have to be a citizen to be eligible for HECS. So that meant that we had to fund her uni semester by semester, really, which was more of a financial challenge for us, especially not selling the house. So it's all a gamble.
Yeah, that's really good to know, Donna. That's there's certainly some differences between being the temporary residents to permanent residents to then citizen of Australia. So it's good to have those financial differences in the forefront of your decision making as well. So that's really helpful. In terms of the migration process, and you mentioned that you came in as a permanent resident. Not everyone's able to do that. There's lots of restrictions, which we've talked about in previous podcasts about, obtaining migration advice before putting in any applications. But for you, talk us through the migration process. Was it fairly straightforward? Do you have any tips for anyone wondering if they should utilise the migration agents, or would you do it yourself?
When we emigrated, we did it ourselves very much. We didn't engage in a migration agent at all. It was a fairly straightforward process for us, based on the fact that nurses were on the list of people that were wanted in Australia. So it was just a matter of following a process. Yes, it was time consuming. Yes, it was a little bit complicated, but it was more gathering together all of the information and uploading that through the portals. I think everything's changed now. Migration, it constantly evolves and moves on. So whether or not it's that simple nowadays, I'm not so sure. But certainly for us, it wasn't a great deal, and we saved a significant amount of money by just doing it ourselves. Just more time and information gathering.
Yeah. What about things that you mentioned that you didn't have jobs when you came here? What about schools and accommodation lined up for when you arrived in Adelaide? how you manage that process? Would you change anything now if you had to do it again?
Potentially not. We knew we wanted to live in the south of Adelaide, so that was where we set ourselves to be. So once we got here and stayed temporarily somewhere, we looked for a rental. The rental market was much easier to access then than it is now, and just went and looked at houses and put in applications for where we wanted to be. So that was very much decided on where the location that we still live in now was very much based on the fact of where we got our first rental. So we went and looked, quite liked a house, put in an application, was accepted for that rental. So that's where we went to live, and then looked at the schools from that area. The children, started school a couple of weeks later. I'd started to apply for jobs. I'd actually made some contacts before I came out. So I went through what was the Division of General Practice at that time, made links with practice nurse coordinators. That's now evolved into be the Primary Health Network nowadays. But I'd set up to have a meet and greet with those once I arrived in Australia. And during that meeting, they told me about jobs that were available locally. And I applied for one of those and got a practice nurse job and started within 2 weeks of being in Australia, which was a huge relief. So that was good.
Yeah, and it's really quite different to coming to Australia on holiday versus actually moving lock, stock and barrel and having this as your new home, living here, working here, children at school, finding jobs, etc. What do you think was your biggest adjustment and why?
For myself, I was very happy from day one, loved where I was working, enjoyed the work, loved the people. My husband didn't get a job. Straight away, the plan was that he was going to settle the children into school and start applying for jobs. Once he started applying for jobs, we found that it wasn't that easy for him to get work. Nurses, the UK nurses are highly sought after. And as a practice nurse in the UK, I had great skills, was highly qualified and experienced, and really was quite in demand when I got to Australia, whereas for him things were different. He applied for many, many jobs and didn't really get those, and became despondent and consequently didn't settle very well in Australia. So for us, that was our biggest hurdle, our biggest challenge was about trying to get my husband settled. And in all honesty, that took several years. We've been here 13 years now, and he will say that it's the best move that we made for us and family. However, in those early years, it was a challenge and it was difficult. You're starting from scratch, making new friends, trying to find jobs. So that was the biggest challenge for us.
Absolutely. And I don't think that's necessarily an uncommon situation to be in either. I know that when we work with GPs that are looking to move to Australia, we always try and find a clinic that we feel is a good match for them. So it's not a case of just putting a bum on a seat in a clinic. It's what are your values? What's important to you? What support is the clinic able to offer? But not just you, but your entire family. The whole family has to be comfortable when they move here. So, it's a big move, to have both of you to have had jobs to move here to would have been a luxury. So you to find a job with just, a couple of weeks of being here was massive. So, like I say, settling the children into school, it's a really big move. And I think anyone considering a move to Australia needs to be mindful of, those sort of emotional side of things as well, because it's huge. You don't necessarily have family here to lean on or others. So, you've done really well to, as you said, your husband is now saying that this was the right move. Then that was great that you stuck in there and made Adelaide your home.
Yeah.
Yeah. So you continue to work in healthcare here in Australia, and you're working in a senior position within the Australia Health Alliance. This is a clinic we've spoken a fair bit about during previous pods. How do you like your position there now, and how does it compare to other roles that you've had in Australia, and then sort of compared to practice nurse roles in the UK? So what are the big noticeable differences between the two locations?
So when I first came to Australia, as I said, quickly got a job in a general practice and enjoyed the job, but in actual fact, there's very little autonomy for practice nurses in Australia. The whole funding mechanism is set up completely differently to the UK, and practice nurses are really overseen by GPs, and GPs have to see every patient to be able to bill and claim funding for seeing that patient. So practice nurses basically don't make any clinical decisions independently, whereas in the UK, I'd see patients, assess them, diagnose, and then decide on treatments for that. Whereas in Australia, I didn't have that opportunity, and it was quite frustrating for myself, who had been in general practice for 15 years in the UK. So fairly quickly, I became a little bit despondent of general practice, and was offered a really good opportunity to work in primary healthcare project work. So for about 7 years, I moved out of general practice and went into delivering primary healthcare projects across Adelaide. I'm working for what is effectively the PHN now. So that was really, really good. But it was all contract work, and then I went into Closing the Gap, which is around working with Aboriginal health, which also was really interesting, and moved on from there into what effectively became an exceptionally well-paid office job. However, I wasn't using any of my clinical skills, and I missed that patient contact. And my husband said, why don't you just go back into general practice? That's where your passion is. So that's what I did. Went back into general practice about 6 years ago now. Moved to AHA 5 years ago, and I've settled here. I've had great opportunities at AHA. I started as the head practice nurse, and was working 2 days a week clinically and 2 days a week in leadership. And over time, that's evolved to be a more permanent leadership role. I do work clinically, I do cover and sickness and holidays, but generally the majority of my time spent in leadership. So I've had great opportunities at AHA. They obviously could see the side of all the experience that I brought to the role, and also quickly promoted. And now I am on board as management for the organisation, which is really a great achievement for a nurse in Australia. So
that's amazing. Congratulations. Quite different from when you first arrived in Australia now then, isn't it?
Yeah, absolutely. Completely different.
So well over a decade now you've been here in Adelaide, and since you've made the big move. So perhaps you could share with us what life looks like now for you. So we talked a bit about when you moved and how you settled in, and obviously your daughter will have truly finished university now and settled here with potentially her own family. So are you all settled and happy in Australia? And have you been back to the UK since you've migrated? And what were your thoughts? Did you think, gosh, we've made the right move, or did you have a bit of a pull to go back?
So the three children now are 32, 30 and 21. All of us had been back to the UK, and hand on heart, I can honestly say that Australia is the place for us, and that's for all of the children as well. My daughter, who is 32 now and is married with her own children, she went back for the first time about 2 years after she came to Australia. She was never keen on emigrating at 19. It was a challenge to get her here in the first place. She went back for 6 weeks, and after being back for a couple of weeks, she phoned and said, "Mum, I'm having a lovely time catching up with family and friends, but I can't wait to come home." So that was, amazing after we'd had huge challenges to get here in the first place. My son's also married, and he has a family of his own. But my younger son's still at home, but they've all progressed, got great careers, good futures ahead of them. Homes that they probably would only have dreamed of having in the UK. They've had fantastic opportunities here, and each and every one of them have been back to the UK, but feel that Adelaide is home.
And would your husband say the same? Is he calling Adelaide home now?
Yeah, myself and my husband have been back. He's been back a couple of times due to ill health of his parents, who consequently passed away. So he has been back numerous times. And despite not settling well initially, he absolutely agrees that this is the best place for us to be. And the last time really look forward to coming back home. So we've got great lifestyle here, good jobs, and I feel that it was definitely the right move, despite being a challenge in the early days. Nothing worth fighting for comes easy. So the hard work really did pay off.
So good. Well, thank you so much, Donna, for joining me today, sharing your story. It sounds like it's been a real roller coaster, a real life example of the highs and lows. But that if you stick with it and you join an organisation that, willing to support your entire family into integrating into Australia, that how valuable that can be. So we've touched on some bits in our GP Recruitment Fundamentals podcast series about migration and finding a home and settling into Australia. And there's lots of useful blogs on our website, the Health Recruitment Australia website, which I would strongly encourage anyone looking to migrate to Australia to have a look at those pods and have a look at the real life stories of people that have actually made the move. So you can catch up on the podcast series on YouTube, Spotify, or the Apple Podcast. Thanks again, Donna, for joining me today. It's been absolutely lovely catching up with you. And we hope you continue to enjoy your life down here in Adelaide.
Thanks very much for having me today, Emma. Great.
Thanks, everyone. That's it for today. Thanks for listening. We'll see you again soon. Bye for now. Thank you for listening to Living the Dream for General Practitioners. Don't forget to subscribe on your favourite podcast player so you don't miss an episode. At Health Recruitment Australia, we want to see more happy GPs, thriving medical practices and healthy communities. If you'd like to join us on our mission, visit healthrecruitmentaustralia.com.au to explore opportunities and get in touch. Thanks for listening.